This is ContactTalkRadio.com, consciousness in action, and you are taking action into your consciousness by tuning into Contact Talk Radio.
And on TuneIn.com, Ping.fm, and UpSnap Mobile.
Contact Talk Radio.
From the Rose City in the beautiful Pacific Northwest, we are bringing you the latest updates in regenerative and stem cell medicine from around the world. It's Pain-Free and Strong Radio with Dr. Tyna Moore.
Welcome to Pain-Free and Strong Radio. I'm Dr. Tyna Moore. I'm your host, and today I do not have a guest. I wanted to take this opportunity to share something with my audience that I just got done lecturing on in Denver last weekend. I was invited by the Colorado Association of Naturopathic Doctors to speak about a topic that's really near and dear to my heart, and it's a talk I've done before. The event coordinator, Dr. Hillary Back, had seen me give this talk at a different conference years back and wanted me to do it for her group of doctors. So I've gotten a lot of feedback since the talk and had a lot of naturopathic doctors contacting me saying, they had never really put the pieces together like that, and that they weren't aware of some of the things I had said in the context that I said them in until they heard me give this lecture, and how it's really changing the way that they're approaching their patients already, which warms my heart. The whole premise of this talk is going to be on naturopathic considerations and treatments of inflammatory arthritic conditions. And before you change the dial, I want you to hold on a second. If you have any kind of arthritis, this podcast is going to be relevant to you. I'm going to go into some of the more commonly known inflammatory arthritic conditions, and I'm also going to cover osteoarthritis. But most people just are under the illusion that, okay, they have arthritis, it's just wear and tear. That's nonsense, to be honest. And I'm going to break it down why. So you're going to want to hang on and listen to this, and you're going to want to share it out, because everybody has arthritis. Once you hit a certain age, everybody gets arthritis. I'm going to do a couple of podcasts on this topic because it's so important to me that all humans be empowered with the knowledge of what I'm about to share with you, and also that doctors and physicians learn this better, because we are failing our patients at an astronomical rate. I am constantly shocked at what walks into my office, patients referred in by other intelligent practitioners who honestly have completely missed the boat in so many cases. And the work that naturopathic doctors do in particular by decreasing inflammation through lifestyle, targeted nutraceuticals, treating the underlying root causes is absolutely 100%, in my opinion, the best way to treat any kind of arthritic condition. And these are things that other practitioners can employ as well. And I want patients to know what this all breaks down to, so that they're not walking around clueless and uninformed and thinking that they just need to get cortisone injections and do what, take NSAIDs and take opioids. I think that's a really terrible way to go. I think orthopedic medicine is handled in the most barbaric way and in the dark ages in this country and throughout the world. And it's shocking. Like, to let you know, if you go to the orthopod, you have three options. They do nothing, and they give you NSAIDs that destroy your gut, and they might give you something else for your pain, or they give you a cortisone injection, which breaks down your tissues. Cortisone is catabolic. It disintegrates and melts your tissues, quite literally. The underlying root cause, one of them, of wear and tear on the joint in any way, in any capacity, is because of instability. So melting the tissues further is a bad idea. And then the third option is surgery. And if you're not a surgical candidate, you get one of the first two. If you are a surgical candidate, or even if you're not a surgical candidate and that doctor likes to do surgery because that's their hammer, then you're going to be a surgical candidate. And we have an old saying in orthopedic medicine that surgery begets more surgery. So I really am on a mission to inform you guys and educate you guys so that you understand what it is you're looking at. Without further ado, I'll jump in. So I'm just going to cover my slides. I'm going to try to make this as non-doctory as I can, because I want it to be in terms that everybody can understand. I attended chiropractic college and naturopathic college concurrently. And so my brain was not just brought up on one or the other. I developed my thoughts about conditions and treatments of conditions concurrently. And I feel like my brain is very unique in that way, because I wasn't I wasn't one kind of doctor and then had to have a paradigm shift to start thinking like another. I was both at all times, and I still am both. I can't look at a person without my chiropractic brain completely analyzing their gait and their biomechanics and how they're moving and how they're holding their bodies and what muscular imbalances are present. And I can't look at them without seeing thyroid conditions and blood sugar dysregulation and edema, swelling, puffy joints, puffy eyes. I can see all of that, skin quality, hair quality. All of that tells me what their underlying musculoskeletal conditions are going to be like just by glancing at them. And I can't take those hats off. And so over the next several months, I'm going to try to give you guys as much information from my brain on this as I can. So autoimmune and inflammatory arthritis are special considerations and musculoskeletal pain management. I would throw in that osteoarthritis is very much in this category too, and I'm going to tell you why. I do think that naturopathic medicine is uniquely qualified to address these conditions. I think that our root cause approaches to help heal the patient and bring them back to homeostasis is what these conditions need. They need a complete systemic overhaul. They don't need cortisone shot in the joint. That said, if somebody has a very severe case of inflammatory arthritis, such as rheumatoid arthritis, psoriatic arthritis, I'm going to name a few others as I go along, we don't want their joints to dissolve. And I don't want you as potentially to all the clinicians listening and to all of the health providers and to all of the patients listening or potential, everyone's a patient to somebody. Hopefully we all have a doctor we trust. The point is if your joints are disintegrating quickly from some of these conditions, you do need allopathic intervention. Intervention from a rheumatologist is going to come in the form of NSAIDs, potentially cortisone injections, potentially DMARDs, which are disease-modifying agents like Humaris and other conditions that really they shut your immune system down. That's how these things work. They shut your immune system down. By shutting your immune system down, your arthritis might feel better and it may not progress as rapidly, but you're shutting your immune system down, which makes you prey to the flu and any infection that comes along. And that's why if you listen to the side effects on the commercials for these drugs, they're horrifying because they're using immune modulating and shutting down agents, basically. Cortisone is put in the joint to decrease inflammation, which makes it feel better temporarily. But like I said, it melts the tissues. So I just want you guys to understand, because I see patients all the time with rheumatoid arthritis and other inflammatory conditions, like the musculoskeletal manifestation of Crohn's and ulcerative colitis. These are called enteropathic arthritis, and entero means gut, stemming from the gut. I see these patients all the time, and they were never given an explanation of how these drugs work that they've been put on. They were never told. They were just told that it's expensive. It might be an injection. It's something that makes them feel significantly better, but they don't understand how it works. And I want you guys to know how this works. Shutting your immune system off, probably not a good idea. Anyway, back to inflammatory arthritis. So there's autoimmune and or enteropathic inflammatory groups of arthritic conditions. And these are characterized by inflammation of the joints and often other tissues. Enteropathic, again, means from the gut. Autoimmune disease is rarely an isolated event, rarely. Not all of these cases are autoimmune, but I like to think of them as being immune mediated. And this is different than wear and tear arthritis. However, I'm not so sure it's too different. I do think that there is an immune and metabolic participation in osteoarthritis. And if I don't get into the details of that today, I will come back on another episode and tell you all about my thinking on that. So there's a few that you may know. Rheumatoid arthritis is the big one when I'm talking about immune-driven and inflammatory arthritis. Psoriatic arthritis is another. Ankylosing spondylitis, some of you may have heard about. There's juvenile arthritis, which is a really devastating and terrible disease process. There's Reiter's syndrome. There's enteropathic arthritis. I don't know why that's put in its own category, because honestly, I think they're all enteropathic, meaning they all have a gut contribution. There's something systemic happening in the gut. And then there's lupus. There's SLE or lupus, which is a super common condition, autoimmune condition, especially in women. And most do not realize how much pain lupus patients are in. Why do I care? Because I have glimmers of these. And I see this all the time when my patients with irritable bowel syndrome come in and their IBS is flaring, you can bet their arthritis is flaring. And commonly the sacroiliac joints will be involved. So patients will present with either one side of their SI joint hurting or both. And if they get an x-ray, I will often see sclerosing of these SI joints in these inflammatory arthritic conditions. If you have sclerosis on your SI joints, if you have had x-rays done of your low back and SI and you see white sclerosing, or you've been told on the report that there's sclerosing, there is something systemic going on. And I recently had a potential patient want to come see me who lived out of town and wanted PRP right away upon this visit, and for a condition in their hip that looked, for all intents and purposes, pretty clear cut. However, after reading the x-ray report, I realized that this patient had sclerosing on their SI joints, which tells me there's some systemic inflammatory condition going on. And I referred them to a local naturopathic doctor in their area to do all of the base work, test the gut, test the hormones, figure out what's going on there before any injections were administered. This is good medicine. The patient wasn't terribly happy with me in the beginning, but I think I'm hearing from the treating physician that they ended up with that the patient is now doing much better and has received PRP at this point, but not until a lot of pre-work was done. So you hear me talk all the time about how I don't think that throwing these regenerative injection therapies around like candy is such a safe idea, and this is why. And I don't think that we were taught this stuff rote in chiropractic college, and I do think that not orthopedic, but rheumatologic doctors understand this, but most other doctors do not have a clue about these inflammatory arthritic conditions. They kind of learn the gleam over version so they can take boards, but they really don't dive deep in it. And like I said, most of these are stemming from the gut, and I have so many studies to show that. This is not old news or new news. This is old news, and all anyone needs to do is put in psoriatic arthritis and bacterial infections, and up will come a bunch of different organisms that are found in people's guts who have that condition, and the list goes on. So this isn't made up woo-woo science. This is basic medicine knowledge that is sort of being ignored, and people are suffering. So they get put on Humira or some disease modifying agent without ever having their gut tested, without ever being talked to about their diet or their gut symptoms or any other symptoms. Speaking of symptoms, a really common symptom that will show up in these types of patients, sometimes well prior to the joint pain, is an ocular manifestation. Ocular meaning eyes. So these are the people who have uveitis or iritis or chronic conjunctivitis. I had chronic conjunctivitis as a kid. I later developed in life many autoimmune conditions. So if there is a chronic conjunctivitis, uveitis, or iritis, especially in a younger person, you should start asking that person questions about their gut. If it's you should go find someone who will ask you questions about your gut health, because there is a tight link between ocular manifestations and inflammatory bowel diseases. Sometimes they go hand in hand, talking timeline-wise, but other times it's sort of a glimmer and I've heard this from countless patients. There was this early case of iritis or this early case of uveitis out of nowhere, or there was this chronic conjunctivitis they just could not clear up out of nowhere. And then boom, a year, 2 years, 5 years, 10 years later, there's these joint manifestations. So just a little pearl there for you. The standard of care for these conditions is suppression, flat out. Simple as it can be. They suppress the symptoms. However, that does not long-term end up well for the patient. So like I said, there's NSAIDs like ibuprofen, Advil, that kind of thing. Then there's the disease-modifying anti-rheumatic drugs, the DMARDs, biological agents, corticosteroids, surgery. And while there is a time and a place for these treatments, like I said, if your joints are rapidly disintegrating from rheumatoid arthritis, please go get on the right drugs to make sure that that slows down, or whatever your doctor is suggesting to you. Don't be this idealistic stoic and let your joint disintegrate, because when these conditions decide to flare up, they can go fast, and you want to keep your joints. But just know that there's a ton of other things you can do to really take care of yourself. So I'm going to quickly throw out some common symptoms, and I want to share these with you, not because I want you to go diagnose yourself or think that this is any form of diagnosis, but I want you to hear this because when I share this with patients, they're often shocked and they didn't realize something bigger was going on. They thought, oh, I thought my hands or my ankles hurt. I thought that this was just a clear-cut musculoskeletal issue. And all of a sudden I start throwing these symptoms out and they're like, wow, I didn't think of it that way. So first, Pearl, if you have bilateral pain in the same joint, so both hips, both knees, both wrists, both ankles, both fingers, both toes, both sides of your body, that's a red flag. That's something that is missed so often. With nearly 99% of the practitioners I talk to completely miss this idea. But if you have pain bilaterally, that's a red flag in the same joints. So if both your wrists hurt, your left and your right, you should start talking to somebody about this. If you have arthritis in your fingers in both sides, this was not a traumatic onset. This is a systemic process. Both hips, both shoulders, that's a big one. Both sides of your SI joints. Those are all cues that this is more than just, oh, I had a trauma and I hurt that joint. This is something is going on systemically. All right. So with rheumatoid arthritis, it's often symmetrical and bilateral, meaning both sides evenly. And it starts in the wrists and the ankles first. So if you have wrist or ankle pain, or the bottoms of the balls of your feet, or the pads of your fingers, you should go talk to somebody. Something's going on there. And do note that the testing done for these conditions can have a lot of false negatives. They're kind of all over the place. So I don't get too hung up on testing or lab values. And I know that a lot of doctors like those, but I think that what's the point? I'm still going to treat the patient the same way I would. I'm going to assumptively treat an inflammatory condition. And as a naturopathic doctor, I have all the tools in my tool belt to do that. I don't need labs to prove to me that something's going on. If a woman shows up in her middle-aged years, if she's, 40 to 50 years old, and she has bilateral wrist pain or bilateral foot pain or ankle pain, I'm going to assume that some kind of inflammatory arthritis is taking foot. And also if she had some history of eye symptoms, remember the eyeball symptoms, and she also has some kind of GI issue like IBS is common. I think that a lot of people learn to live with these gut conditions and we don't talk about them because we're embarrassed, and people learn to live with them like they're normal, but they're not normal. It's not normal to have diarrhea every day. It's not normal to be constipated and poop once every 3 days. That is not normal. It's not normal to eat something and then have to run to the bathroom and lose your bowels because something irritated your gut. Like something is going on and your gut is inflamed. So just know that with rheumatoid arthritis or RA, from 40 to 50 years old, it definitely prefers women with a 3-to-1 ratio. Over 40, it's kind of 1-to-1 equal with men. So don't miss this, you guys, if you're clinicians or practitioners, and don't miss this if it's you as a patient, because what's coming next is not a good sign usually for people. Usually the hallmark is wrists and ankles, and from there things tend to get worse. So they'll get a thickening of their synovial joint, which is that's the joint capsule, and it'll start to thicken. And when you get synovial thickening, that means something systemic is coming. So just note that. Another common condition is psoriatic arthritis. And that does not present so much symmetrically, meaning it doesn't really show up on both sides of the body. But the big clue here is if they have psoriasis of the skin. If they have psoriasis of the skin, the chances of them developing psoriatic arthritis are pretty high as life progresses. So just know, if you have psoriasis of your skin, that's an autoimmune condition, and that means something is going on in your gut and you need to have it treated. If it progresses into a joint condition, things get much worse. Another common thing with psoriatic arthritic people is that they will have fingernail changes, which is very interesting. They will have changes to their fingernails themselves. They will get they'll start to peel and pit. They'll get pitting, looks like little chunks of their nail are missing, little pits. And they might get compromised with fungus, and people are like, oh, you have a fungal condition. It's like, actually it started with the nail changes characteristic to psoriatic arthritis. And they will often get reddening around their nail bed. So where the cuticle is, they'll start to get really reddening or swelling there along with these nail changes. These don't have to be severe. These can be subtle, but if that's happening and there is a rash or a history of psoriasis on the skin and they start presenting with joint pain, boom. Another classic presentation is they'll get what's called sausage digit, which is one finger or toe will swell up huge out of nowhere. This happened to me years ago in school. My pinky just swelled up like a balloon. And I was like, oh, something obvious. And I have gut issues. And I'm like, and I have pain. So something is, tied there. It's nice to be able to put these all into a little package and call it one thing, but I'm just going to tell you now that it's usually gut-driven joint inflammation. Let's just leave it at that. How it tests out in the labs and how it's diagnosed is, to me, somewhat irrelevant because, I'm still going to treat them aggressively with lifestyle medicine. Another thing that will happen in psoriatic arthritis is they will get that sacroiliitis or that SI joint pain, and it's often one side, not both. But just know that if any of those symptoms are queuing up, something's probably going on that should be looked at, and that this is not normal wear and tear. Another condition that's common, mostly in males, young males it'll start with, and it'll move, some women will get it, is ankylosing spondylitis. This is a condition where your spine fuses, which is such a bummer. It'll start in the SI joints, and meaning the low back, and it'll stiffen up and it'll ascend the spine. It'll start to fuse the vertebrae of your spine. And so you literally get a spine, they call it bamboo spine because it's like a bamboo rod. That's what happens to your spine. Your vertebrae don't rotate anymore. They don't flex or extend. They just fuse. And this is completely 100% been connected to Crohn's disease, and also which has been connected to some kind of infectious agent. The point being is the infectious agent enters the body. It upsets the gut gets inflamed, and then from there, your musculoskeletal system gets involved and your immune system lights up. And so these people will present with bilateral back pain. This is the case in all of these conditions I'm talking about, by the way. The gut getting queued up, you get leaky gut, and you have a bacterial infection in there, and then the sequelae of all the rest of this goes down. So just know, ankylosing spondylitis, think about Crohn's disease. If you have Crohn's disease and you're getting a lot of back stiffness, think about ankylosing spondylitis, and just know that there is almost always an infectious root cause. Klebsiella is the big organism. Go ask to have it tested. Klebsiella has been linked to it in lots of studies dating all the way back to the 80s. None of this is made up. This is most common in young men, but I have seen Crohn's disease predominantly in women of various ages, and they have also suffered from some form or another of ankylosing spondylitis. A lot of pain. And now this can abate, this can ebb and flow. So you might have years and years of joint issues and pain and spinal pain, and then all of a sudden it goes away. Really depends, but just know that if you're starting to see these things together, I want you to start asking questions to your doctor. And also ankylosing spondylitis may affect the rib cage, the shoulders, and the hips. So the joints closest to the spine, the big joints. So a quick rundown, again, rheumatoid arthritis is bilateral and symmetrical, and it most often starts with the wrists and ankles. People may get nodules on their joints or nodules around their finger joints, the furthest ones out, the ones closest to the nails. So just know that. Psoriatic arthritis, they'll often have a history of skin psoriasis. They will have finger involvement, and it's not symmetrical, meaning it's on one side of the body or the other. So this can jump around, and this is why it gets confusing, and people will often miss it. And they may get a sausage digit. So one finger will swell up really huge. And then ankylosing spondylitis, more common in men, that starts in a younger age. Their SI joints and their low back will start, and it's usually bilateral and symmetric, meaning both sides, and they will start to have a fusion of their spine all the way up the spine. And they often will have some kind of GI distress or Crohn's disease attached. Now, if the Crohn's disease is not yet diagnosed, they may just have really severe gut issues and not, think anything of it. They'll think, oh, well, my family all had this same kind of symptom, my mom or my dad. And so that's just, we have bad guts. That's what I hear people say. Oh, I just have a bad gut. I'm like, no, you have Crohn's disease throughout your entire family lineage. That's actually what's going on. For juvenile idiopathic arthritis, all I want to say is if you have a child and one of their joints swells up, boom, you probably have a diagnosis and you need to go get that looked at immediately. It's either immunologic, meaning their immune system's driving it, or they have an infected joint and they're going to lose their joint. Either way, they're going to lose their joint if you don't get them in to see somebody. So if one of your children has a joint swell up severely, go get help immediately. Same for you. You don't want to have any kind of you don't want to have a swollen joint that persists. That's not normal. I know it seems normal because so many people suffer from this stuff, but it's not normal. Another condition is Reiter's syndrome. This is a reactive arthritis, meaning, which they all really are, but it's characterized on its own. There's usually an involvement of, first it's contracted most often through a sexually transmitted illness, and it's more common in males. And they will have pain upon urination, which is sort of the telltale sign of a STD. And then next thing, they will get vision changes or eye involvement. So conjunctivitis, iritis, whatever, painful eyes. And then their joints will start to hurt. If that sequelae happens, that's usually Reiter's or reactive arthritis, and they should go get checked for an STD. Easy enough, right? And it can happen to any age. There will usually be some symptomology of an STD first, but not always. Sometimes they'll present with a joint pain because they've ignored the others. Really depends on the severity of it. I know a patient who recently got iritis after a female in her 60s after having long-standing gut issues following a round of antibiotics. And we thought that the gut was better. And then next thing you know, she gets iritis, which is a horribly painful condition, but she didn't complain because she's a tough old gal. And eventually the pain in her eye got bad enough. She went to the eye doctor. They missed it because it was presenting weird. And then a few months later, her cornea fused to her lens. So because of all the inflammation in the eye, which is horrible. So just know that if you have any eye symptoms that are persistent, go get checked out and think about these conditions. I'm not trying to scare anyone. I just want you to think about this. It's not normal to have chronic eye issues that keep coming back. If you have chronic dry eyes, you have an autoimmune condition. And if you have an autoimmune condition, you're kind of on the rainbow of other autoimmune conditions, meaning any of these are fair game for you. If your immune system's lit up, it's lit up. And then lastly, before we go to commercial break, is enteropathic arthritis. And what this means, again, is gut-driven arthritis. Most often, this is categorized into ulcerative colitis or Crohn's disease conditions. But I'm telling you, anybody gets a good round of food poisoning in a foreign country or gets a bug from bad water somewhere while traveling and then develops arthritis, that's enteropathic arthritis. And like I said, all of these conditions start and have been linked to certain specific organisms in the gut. So in my opinion, they're all enteropathic, meaning they all start in the gut. This is why naturopaths and functional medicine doctors test your gut first, and why it's so important to have your gut tested, because it is really the link to so many health conditions. When your gut gets inflamed and then it becomes permeable or leaky, you have a whole immune system response that it's kind of a shit show from there. So I've lived it. I understand how this works. I got a terrible case of Giardia in Mexico, and that was what prompted me to go get my gut tested later. I kind of lived with it for months, thinking it was just normal to have horrible diarrhea all the time. I thought, well, I just have a bad gut. Everyone in my family has a bad gut. And then I got the sausage digit along with a ton of pain, but I was already having pain. So it was just becoming more pronounced. So with enteropathic arthritis, ulcerative colitis or Crohn's is often a link. So if you have either of those conditions, or you know someone who does, and they start suffering from joint pain, just know it's probably connected. It is most often the spine. It's bilateral, meaning both sides, and things will start to fuse, just like ankylosing spondylitis, probably because it is. I don't know why it's categorized as its own category, but just know if you have ulcerative colitis or Crohn's and you start to get a stiff fusing spine, and your SI joints hurt bilaterally and it starts to go up your lumbar spine, you're probably looking at something like this. It begins in young adults. It can happen at any age though. And they will get peripheral joint pain too, but more often it's the axial spine or the spine, the central part of your musculoskeletal system. And on that, I'm going to take a quick break. We'll come back and we'll dive into this a bit further and talk about osteoarthritis and what you can do about it. You are listening to Pain Free and Strong. I'm Dr. Tyna Moore, and we will be right back. Dr. Tyna here. I wanted to share with you a product that I've been using for about 2 months now that has been an absolute game changer for me. As many of you know, as part of my tribe, my gut is not always the most cooperative. Since implementing Megaspore Biotic in my daily routine, it's been a completely different story. There was a breaking in period, to be sure, but the results have been nothing short of amazing. I've had a significant decrease in bloating and discomfort in my guts. And if you didn't know, your gut health is intimately related to your pain levels. The developer of Megaspore Biotic, my friend Karan Krishnan, and I sat down and created a free webinar all about it. Head over to my podcast page at www.drtyna.com and you can find a link to the webinar where you see the big Megaspore Biotic picture. You can also purchase the product via that link so long as you use the code Dr. Tyna, all one word, all uppercase letters, DRTYNA. It's a completely unique and different product, so be sure to check out the webinar now. Welcome back to Pain Free and Strong Radio. I'm Dr. Tyna Moore, and today it's just me. I don't have a guest, and I'm talking about inflammatory and immune-driven arthritis. This is a really important topic because most people don't realize that their arthritis is coming from a systemic or inflammatory cause. They think, oh, it's just wear and tear, my knee's worn out and it hurts, and that's not the case. It's not even the case if it really is just wear and tear. There is a sequelae or a process that happens in the body when joints are injured and they become inflamed and on it goes. I will tell you 99% of the time, people's chronic pain is being driven by something else in their body. I would like to say it's as simple as inflammation in the body, and I would like to say it's as simple as all the things I'm presenting today. But I will tell you a side note, it's often trauma-induced, and I'll come back and do another episode on that. It's often trauma-induced, and it's usually when people deal with really chronic pain or their immune system gets really crazy and out of control, I often have seen and realized that adverse childhood events and things that have happened to people in their youth play a big role. But there's a lot we can do just on lifestyle medicine, naturopathic medicine, and I want to continue on describing some of these arthritic processes so you understand them better. So we talked about several: rheumatoid arthritis, psoriatic arthritis, ankylosing spondylitis, Reiter syndrome, and enteropathic arthritis. These are conditions all driven and have been linked to gut infections as sort of the spark. The last one is SLE, which is systemic lupus erythematosus. I can never get that word out. Arthritis is rarely the only symptom, but it's the most common. And so these patients will present with involvement of small joints of the hands, wrists, and knees. And it may be symmetrical, it may be asymmetrical. The pain is usually disproportional to the swelling, and so they get written off. This commonly presents in young women, and they get written off, and they're saying, oh, there's nothing, we've x-rayed it, there's nothing there, nothing's wrong with you. And then the next thing is the woman will often start to get the butterfly rash. And if those two things happen together, we know we have lupus going on. Just so you know, all autoimmune conditions ultimately are just connective tissue issues. They are connective tissue conditions. The immune system is breaking down the collagen and connective tissue in every single case. I'm talking Hashimoto's, I'm talking MS, I'm talking any autoimmune condition. At its root is a collagen issue. And so the body's breaking down collagen, it's attacking your collagen. It just decides on where. So for me, I get joint issues and manifestations, and I get neurologic. And for other people, it's their gut and their whatever. But usually all of them go together. I rarely see any of these in isolation. It's just a matter of getting a good diagnosis. So quickly, I just want to share, there's so much literature to support this. There's, back in 1996, I've got a study here talking about these arthropathies, which are these conditions I'm talking about, and their well-documented connection to gut inflammation and intestinal permeability. So we knew this back in the 90s. It's in the science. I've got another study from 1982 here showing that fasting leads to a decrease in intestinal permeability and symptoms in rheumatoid arthritis patients. Fasting makes the gut less leaky. And commonly, when I was working at the clinics as a student, and they were the low-income clinics where people did not have a lot of options for resources, they could not afford fancy testing and they could not afford fancy medication. We would just have them do modified vegetable fasts or modified bone broth fasts, and they were always being covered by one of us. So we were monitoring them. I would not encourage you to do these on your own, but just know that fasting and giving the gut a break can be a huge help. There is a tight connection dating back to the 90s again on spondyloarthropathies, which are these conditions, and inflammatory bowel disease. So we know that IBS and IBD is linked to these musculoskeletal manifestations. Reactive arthritis is triggered by an infection, either of the genitourinary or the gastrointestinal tracts, meaning so some kind of, urinary tract infection or some kind of GI infection. The common triggering bacteria in these reactive arthritis are Salmonella, so a bad food poisoning, Shigella, Yersinia, Campylobacter. These are all really common organisms that we find in people, and it can cause your immune system and your genome to light up. So now we've got a genetic involvement, turns the genes on. And once the genes are on, we start getting the spondyloarthropathies. We've got links to specific organisms dating back to, the 2000s. Prevotella copri is an organism that's been isolated in patients who have rheumatoid arthritis. It has been suspected that rheumatoid arthritis was linked to infections or perhaps even diet, but this is the first finding of an association with a specific organism. Klebsiella, remember I said Klebsiella and Ankylosing Spondylitis and Crohn's disease? That's a really tight link, and it appears that the starch in the diet is the main source for the Klebsiella growth in the large intestine. Hence, increased consumption of starch-containing foods by genetically susceptible individuals, such as those possessing the HLA-B27 genes, could result in the initiation and development of ankylosing spondylitis or spondylitis-associated Crohn's disease. That's straight from that study. And that study was done in 2013. So this is another reason why you hear people saying, oh, I went on the keto diet or I went on a low-carb diet. I felt so much better. Yeah, maybe metabolically that was a good idea. Maybe it wasn't. Maybe. And here's a third factor. Maybe it was or wasn't, but maybe they just started starving off the organisms in their gut. And the keto flu that you hear about might not be from full-on metabolic changes in the body. It might actually be from a Herxheimer reaction, because when you start starving these organisms of the starches that they crave and the sugars that they crave, you will often start to feel very sick and fluish if you have a lot of them in there. So just know that it's not uncommon when I put people through a gut cleanse with oregano oil and other supplements that I use to really clove oil and things like that to really get their guts cleared out. You definitely want to do this under the supervision of a professional, but they will start to have a Herxheimer reaction. We call it a Herx, and they feel just awful because they are having a very profound die-off response to many of these organisms in their gut that they have been feeding all these years with high starch, high sugar items. So just something to think about there. That's why fasting can be so potent. Streptococcus and psoriatic arthritis have been linked. Proteus is associated with rheumatoid arthritis and ankylosing spondylitis. And again, gonorrhea and chlamydia are linked with Reiter's syndrome. And this is well established in the medical literature. And this list goes on and on and on and on. And since I made this talk, I found so many studies just even further on RA and all these other conditions. So what's really going on? Basically, the bug gets in the gut gets inflamed, it gets leaky, you get this ignition of your immune cascade based on this local inflammation in the lumen of the gut. And then the two drive one another. And then there's these endotoxins and exotoxins that the bugs themselves start to secrete, which make you feel horrible. And then there's this thing called molecular mimicry, which is basically immune confusion. The body looks at the bug and says, oh, you have these things on these flags on your cell wall. They look an awful lot like what's going on with the thyroid. And so then the body turns around and builds antibodies against the bug, but the antibodies get confused with your own tissues, and then your joints get attacked, or your thyroid gets attacked, or all of these other things. So to me, any autoimmune condition first starts with an ignition of the immune cascade, and that usually starts with some kind of bug in the gut. That doesn't mean you kill off all the bugs in one fell swoop and it all goes away, because the immune system is now primed. It means you work with somebody who knows what they're doing, and you dig deep and you figure this out, and you do it in a gentle way. I'm all about nudging the body into health, not slamming it. I just was talking to some people on Instagram about, they were saying that there's these places popping up all over town where they put you in a far infrared sauna, get you all hot, and then throw you in a cryo chamber to freeze you to death. I think one of those two modalities on their own can be very powerful, but the two of them combined sounds terrible. So anyway, I'm all for ease of execution here. So then we've got the guts inflamed, we've got the immune systems lit up. The people involved here are often eating poorly nutritionally. I know I was. So poor nutrition leading to disrupted microbiome, further perpetuated by chronic stress. They get these chronic infections that set up, or small intestinal bacterial overgrowth. If you haven't heard of the word SIBO, you should look it up, especially if you have a lot of burping, belching, and flatulence. You might want to consider SIBO. Please don't come back and ask me who to go see, because I don't know, but you can do your own research and figure out who is going to be a good fit for you. And then we get further body inflammation, and we get joint involvement. And just know that all of your tissues of your body are being affected. Your brain is being affected. Your brain gets lit up. The brain loves to get lit up. And once it's lit up, it drives further pain and further chronic pain called central sensitization. It basically lights up your nervous system, and now your nervous system is hot to trot and fires off way too quickly and readily to pain when it shouldn't. And then your nerves and your body get confused, and what used to sense pressure and temperature and sharp and dull now fires off your pain receptors. So now when you get a hug or you have pressure put on you, instead of feeling pressure, you feel pain. And this all turns into a big mishmash. And it all started with this intestinal permeability, which is probably driven by chronic stress, lots of drug use, meaning pharmaceutical drugs like NSAIDs, antibiotics. It's just endemic to our culture. And then disrupted microbiome, disrupted flora in the gut, and then boom, there it goes. So when do I suspect this as a doctor? I suspect it anytime I see a patient sitting in front of me who has gut issues and joint issues. Those two things right there make me go, these are probably related. If the joint issues are bilateral, it's definitely related. If the gut issues happened years prior and maybe there was some concomitant ocular issues, I definitely get suspicious. So based on everything I just told you, if you took really good notes, you probably will have some idea that this is either affecting you or your loved ones or your patients or your clients. And just know that these joints will often, but not always, they'll be boggy. And I don't know how else to say it. It doesn't mean they're big and swollen. It just means they're boggy. And it makes me wonder, just aside, your hormones are intimately related to this. And people who suffer from low thyroid or hypothyroidism, if they're female, I'm going to say that probably 95% of the time they have Hashimoto's. That's also in the literature. They just haven't been diagnosed yet. If you have Hashimoto's, like I said, welcome to the rainbow. But having your thyroid go low on you can also make you hurt really bad, and it can make all these joint conditions hurt a lot worse, and it can make you a lot boggier. So that's a whole other conversation. I've done a whole talk on that alone, and that would probably be an episode for another day. But just know that boggy, and painful, I want you to think thyroid, and I want you to think of your other hormones. If your estrogen is too low, you lose the elasticity in your tissue, so you're way more prone to damage and to traumatic injury. Things just rip and tear very readily. If your testosterone's low, and I would say kind of the same thing, and testosterone's anabolic, it builds tissue. So you need adequate levels of testosterone to heal. So if you're a woman that's 40, 45, 50 or older, start thinking about your hormones and find somebody that can work with you. So quickly, osteoarthritis, super common. People think it's wear and tear. I was the token girl in chiropractic college who was also a student in naturopathic school at the same time. And I used to raise my hand and be like, well, what about diet? What about this? What about that? And they'd be like, no, this is just wear and tear. They were wrong. It's not just wear and tear. Super common. It affects the large weight-bearing joints most often. There is stiffness and pain. There's limited range of motion. And how I can best describe it is they will wake up and feel stiff, and they'll feel better as they get moving a little bit. Or they will get out of a chair that they've been sitting in for a long time. We call it movie theater chair. So they've been sitting at the movies and they get up and things are really stiff. That joint's really stiff and swollen and tight. And it feels better when they move it a bit. But if they overuse it, it gets painful. So that's pretty classic osteoarthritis. Males are affected less than females. And just know that it's really common once you're 65 years or older. No one gets out alive on this one. We all get it. And in fact, you can image the heck out of it if you want. I'm going to do other episodes on imaging and why I'm not a huge fan. Imaging is going to tell you what, because how is it going to change the treatment any? Your treatment options are pretty limited, as I told you. You can take NSAIDs, you can have a cortisone injection, or they can do surgery. I think all of those are pretty terrible. I offer regenerative injection therapies. Well, I've closed my practice, but you've heard me talk on and on about prolotherapy and PRP. I would seek that out. That's a regenerative process. However, if you have an immune contribution or your hormones are screwed up or you've got some kind of inflammatory immune modulated autoimmune arthritis that is looking a lot like osteoarthritis, you might flare. So I want you to work with somebody who knows what they're doing. Osteoarthritis is a systemic metabolic disease. It's not just wear and tear. I actually think of it as a type of diabetes of the joint. It can also be if a person gets an infection, it can seed the joint, and the joint will not present as a septic joint. It will just erode quickly and look very osteoarthritic. But to me, that says something got in there. Something affected it. So I hope that's clear. I hope that you know that osteoarthritis, yes, it does happen after you've injured a joint or you've had surgery and the structure of that joint has changed or the integrity of that joint has changed or the way that joint moves has changed. But more often than not, in all of the tens of thousands of joints I've treated, there is a definite connection to how inflamed and boggy that person is to how bad their, quote unquote osteoarthritis is. I never isolate osteoarthritis to a clear-cut wear and tear. To me, especially if it's a female, especially if she's 45 to 65, that to me is usually some kind of hormonal and or immune involvement or both. And you really need a solid doctor that knows what they're doing. This is not a case for someone who's just graduated or been out 1 to 5 years. This is not the case for an MD who just went to a functional medicine weekend course and wants to. This is a case for somebody with a higher level of skill. So do your homework and find someone. Please do not email me. I cannot answer. I get so many requests for referrals every day and I can't answer them. So real quick, classic case of an inflammatory arthritis. She's going to be female, 45 to 65. Just put this in your head and this will help you, especially if she's deconditioned and boggy. And I don't have a better way to say it. It's just these people tend to be boggy and they tend to be deconditioned and not move very much. Their pain will be bilateral, especially the big joints, meaning both sides. There's usually no traumatic onset. It's usually just cropped up for them. They will tend to have light eyes and light skin or be of Anglo-Saxon descent. If you have light eyes or light skin, you are probably sitting there waiting for osteoporosis and for some kind of immune-regulated joint issue. They may present with a skin issue, some kind of skin issue, and it doesn't just have to be psoriasis. All kinds of skin issues are linked to gut issues. They will often have gut issues if you inquire and you start asking, and they will have pain that waxes and wanes. Remember, I said they'll go into a flare and it completely abates, and they might have long periods of time where they have no pain, but it'll wax and wane. Is it osteoarthritis? Is it an inflammatory arthritis? Or is it a mixed bag? I often see a mixed bag, to be quite honest with you. If they have synovitis, and this is going to be very hard to tell on yourself, but I can tell when someone has synovitis, that's a thickening and inflammation of the joint capsule. I can see it under ultrasound and I can feel it with my needle as my needle traverses it. And in fact, as I approach the joint capsule under ultrasound, the patient's face will go, oh, like they immediately feel tremendous pain, even as I'm coming upon the joint capsule. That to me says they've got synovitis. And usually as I traverse, it's thick and gummy, and definitely have thickening of that joint and inflammation of that joint capsule. I always know at that point there's a systemic contribution happening, and that this is the beginning of a destructive process. If the person continues on with their lifestyle the way that they are, it is not going to go well for them over the next 10, 20 to 30 years. So test or not test, that's up to you. I encourage you all to seek out your own practitioners and decide what is best for you, because I don't want anybody getting missed. I'm all for doing what you can afford and what you are needing. And I want you to believe your practitioners have your best interests in mind, and that they're trying to get you answers too. So is it severe and progressive? If so, talk to somebody, a rheumatologist, about a more serious drug like the DMARDs, because you don't want these joints can erode very quickly. If it's not severe and progressive, I think working with a really solid naturopathic doctor or a functional medicine doctor is a great idea, and get your lifestyle managed. They have the tools. They have the best tools for treating this at the root cause level. Test the gut regardless. So work with one of these docs to test your gut, and then know that your diet, your rehab and movement habits, your adrenal and hormonal status, your thyroid status, all of those are super involved as well. Very quickly before we end, I want to give you my top, I don't even know how many are here, but this is basically my naturopathic treatment guidelines, period. I'll just run through them real quick. We've got about 4 minutes. Sugar is Satan, period. I hopefully have convinced you that these bugs are driving this pain, and you feed the bugs and you feed the pain. They love sugar, period. This is why I'm so adamant that people stop eating sugar. It has everything to do with what you're choosing to feed in your gut, and it also has everything to do with your blood sugar regulation. Take care of your mitochondria, meaning avoid toxins, avoid lack of exercise, do everything you can to learn about mitochondria and how you can really take good care of your mitochondria, and take care of your microbiome. Don't eat crappy food. Eat like you give a damn. An anti-inflammatory diet is a great place to start. Be concerned about getting your hormones balanced. That's priority number one. Your sleep is sacred and absolutely non-negotiable. Do everything you can to optimize your lean muscle mass. Build skeletal muscle. I have lots of episodes on that and lots of content on my website. Give yourself permission to rest. I think a lot of these conditions afflict women and men like myself who are type A, like to go, 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 and permission to rest is granted. If you don't rest, your body will force you into resting. And as you all know, if you followed me for some time, I get sidelined by pneumonia often enough that my body's like, oh, we're going to make you rest. Avoid stress like the plague, avoid exhaustion, and avoid cortisol bursts, meaning anybody or anything that makes your cortisol surge. So if you feel angry consistently around a certain situation, or you feel angry consistently around a certain person, or you feel your heart rate elevate, get rid of that stuff. Get away from it. Go learn to meditate. If you can get rid of those people, places, or things in your life, though, just get rid of them. There's certain things that trigger me, and no matter how much therapy or meditation I do, they still trigger me. So I just avoid them if I can. Avoid inflammatory cardio exercise. I'll come back and talk about this another day. I have a lot of this on my website too. Cardio is inflammatory, and in these types of patients, it can be very inflammatory. Again, avoid toxins. So skin products, hair dye, nail polish, all the toxins we breathe in and put on our bodies, try to cut them back as much as possible. I have podcast episodes on this as well. On that tip, avoid toxic relationships. Again, people who are toxic to you or who give you cortisol bursts are probably people who are making you sick. They have done studies to show that if couples argue, they have immune dysfunction and downregulation for 3 to 5 hours, and they have inflammation upregulation for 3 to 5 hours. So if you're walking around in a relationship with somebody that you fight with all the time, you are chronically inflamed and you are chronically immunocompromised. And lastly, strength train. No matter what you do, build good muscle mass. I like the kettlebell system developed by Strong First. Strong First. It's all one word. Look them up. Find a coach in your area. This is approachable to anybody, any age, any size, any strength. You can start with kettlebells because they make them super small to get you started. And make sure, on the last note, get enough sunlight, get enough clean air, make sure you're drinking clean water, Sauna, sweat, detox, cook your body, get it hot and get it sweaty. Sleep, sleep, sleep. Stress modulation and meditation. Eat intentionally, eat like you give a damn. Scrutinize everything you put in your mouth and know that it's either poison or it's nourishment. Strength train regularly and respect your hormonal status. And that is it for me today. I hope you enjoyed this. I encourage you to go back and listen to it again and take notes. There's a lot here. I kind of made you drink from a fire hose. I'm Dr. Tyna Moore. This is Pain Free and Strong. If you would like to know more about those treatment guidelines I just gave you, be sure to head over to my website at drtyna.com. That's DRTYNA. Grab my free book, Pain Free and Strong, and there's several chapters in there that will give you the details on all of it. So with that, I thank you, and I will be back next week.
You've been listening to Pain Free and Strong Radio with Dr. Tyna Moore. Dr. Tyna offers a wide range of online courses for both physicians and to the public. To learn more or to work with her as a patient, visit her online at www.drtyna.com. That's DRTYNA.com.